Hi everyone, my name is Carol Ye Garner and I am a Royal Crown Diamond, and my topic today for the summit is talking about the new Young Living Health Plan. So we're going to cover what the health plans are. We're going to cover how to build a sustainable business using these health plans and how to share with your friends, your family, and other holistic practitioners so that you can build a sustainable, consistent, recurring income with Young Living. Okay, let me share my screen with you. All right, so we are going to talk about the Young Living Healthcare program that Young Living has partnered with Clearwater. Clearwater, you're going to learn more about. But first, let's get into some really surprising healthcare facts. So 30 million people don't have health insurance. And statistics show that 50% of Americans have medical debt. And a recent survey found that 2/3 of respondents avoid getting medical help because they're worried about the cost of that. More than 65% of bankruptcies involve medical debt. And that was really surprising to me, but this is even more surprising. 90% of the people, of that 65% that have medical debt that had to go into bankruptcy, 90% of them had insurance. So it just goes to show that the system is broken. Health insurance is broken. So Clearwater is a company that has been around since 2018. They are a healthcare vendor. They offer regular traditional health insurance plans. They offer health share based programs, and they offer supplemental insurance offerings as well. So ClearShare, the part of Clearwater that Young Living is partnering with, is a nonprofit. And that really allows us to put our health decisions back into our own hands. It gives us freedom and freedom of choice. So Clearwater is kind of like the Young Living of healthcare. They want to disrupt the health insurance industry, just like Young Living wants to disrupt the wellness industry. So what is a health share? You might not be familiar with what a health share is, but it is a community of individuals who combine their money and they pool their money together, and then monthly contributions replace the traditional health insurance premium. So everybody is pooling their money together, and then when people have costs involved with their medical care, that money is paid out through that pool. Everybody has an annual max. If you're on the ClearShare program plan, you will have an annual max, which equates to a deductible. And that annual max must be paid before your expenses are shareable. Health shares typically share about 100% of medical expenses after the annual max is shared or is fulfilled. So these health shares have been around since the 1970s. They're usually pretty religiously focused, and that's the main reason why I never joined one before, is because I am not religious, and there are some pretty strict religious rules that you have to have. This one is not religiously based at all. It's just ethically based, like, are you a good person? Don't hurt people, don't drink a ton, don't use drugs, that kind of thing. The differences between health sharing and traditional health insurance. The main one is this one that we are partnering with Young Living is partnering with, is a nonprofit. Traditional health insurance is for profit. All that money is getting collected. The majority of it is going to pay the company and line the pockets of the corporate staff. This company, Clearwater, with ClearShare, has a nonprofit organization. So the money cannot pool up. They can't give more money to the executives of the company. The money is strictly there to pay for the actual medical care of its members. And it has an open network of providers. So there's no network. If you have Kaiser, if you have a specific doctor that you love to go see, you can still see the Kaiser doctor or the Blue Cross doctor or your favorite holistic doctor. There's no network. I already mentioned that there's an annual max versus a deductible. There's a low to no denial rate with ClearShare, with health sharing. Once your annual max is met, pretty much all medical expenses are shareable if they meet the qualifications. There's very few things that don't meet the qualifications, which compared to traditional health insurance, there's a very high denial rate. Even when you meet your deductible, there's usually a split between what you have to pay, an 80-20 split. Once you meet your deductible, you still have to pay 20% of whatever costs are involved. But they actually have retired doctors that they hire that go and read through all the insurance claims to find that one little thing that will help them deny that claim. And that's why there's such a high rate of medical debt and bankruptcies due to medical debt, is because people think that they're getting coverage when really they're only getting an 80-20 split. And if they have a big medical need, sometimes, a lot of times, it's denied. So a health share really puts your healthcare decisions back into your hands, puts more of your hard-earned money back into your pockets. But one thing to make sure that you know is that health sharing is not health insurance. It is not health insurance. There's 5 states that do not see health sharing as Affordable Care Act requirements, but there are some ways to deal with that, and we won't go into that since this is just a more of an overview. Next up, so we've got 3 different choices that now you have as a Young Living member. You have just the medical ClearShare for those who just want coverage for medical and emergency care. You have holistic, which is a health plan for those people who want to keep their insurance plan. Maybe they're getting their insurance through their work or their spouse's work, and it's very reasonably priced, but they want to see more holistic people. And this plan is also the plan that is available for anyone over 65 that's on Medicare. So this is a good plan, the ClearShare. It's going to save you money for medical and emergency care. This is better, the holistic plan, but the best plan is the holistic plus ClearShare plan. So these 2 programs are put together and combined. Here's an overview of the services that you can get in the 3 different plans. So with just the medical emergency ClearShare, you're going to get your emergency care, urgent care covered. You're going to have $0 telemedicine 24/7. You'll have an app. You'll have access to telemedicine 24/7, 365 days a year, and you get a nurse practitioner or an MD on the phone, on your phone within 10-20 minutes max. And so you can really use this almost as a concierge doctor option. You won't get the same care provider every time, but you will have a doctor or a nurse practitioner in your pocket at all times. So for those of you that have kids that play sports, you'll be able to get on with someone medically trained to be able to see, like, does this warrant something that we need to go to urgent care or the emergency room? Does this need stitches? Does this, was this a concussion? All those things will save you time and money from having to go into the pediatrician's office, the doctor's office, urgent care, or emergency rooms by using this telemedicine option. You will have $0 care coordination services. So there's an amazing care coordination program that Clearwater offers. I've never heard of anything out there like this. If you have a planned medical procedure, ideally, you're going to contact the care coordination team at least 21 days before this planned procedure or labs or whatever kind of medical care that you know ahead of time you need to get. And if you use their recommended providers, the care will actually be free. And that's even before you meet your annual max amount if you use their preferred providers. So for an example, say you had a knee surgery that was not an emergency knee surgery. It's a planned thing. You've been on the plan. This is not a pre-existing condition. And you know that after a while of whatever treatment, you need to get knee surgery. You're going to contact the care coordination team. They will recommend a smaller surgery center. And that's going to save everybody money, but it's going to give you better care and better outcomes because small surgery centers provide way better care than a big hospital. So let's say, for example, that scheduled surgery with a surgery center would cost $60,000, but in a regular big hospital, it would cost $100,000. ClearShare is willing to pay the $60,000 with no annual max out of your own pocket because you just saved them $40,000 by not having your surgery in a hospital. So the care coordination service, they're not going to be able to help every single thing, but it's definitely worth contacting if you have a known issue that you want to get taken care of ahead of time. You want to get at least 21 days before that. So that's a phenomenal service that they have available. You also are going to get virtual mental health services, childbirth and delivery services. You can have a hospital birth, you can have a birth center birth, you can have a home birth. And birth center and home birth, as long as it's with a licensed midwife, then you are good to go. $0 generics. Now, with the holistic plan, you're going to still get the telemedicine, the health, virtual mental health, the generic drugs, and you're going to get $50 to $75 of Young Living supplements and oils reimbursed every single month. So when this whole plan was being created, we really were asking, could we get Young Living supplements and oils somehow reimbursed? Because we know these products really help your health and wellness. And the CEO of Clearwater went and talked to the actuaries, and the actuaries knew Young Living by name. They knew the science behind it. They knew how potent and useful our products were, and it was an instant yes. They were so happy to have this as part of this plan. So here's a health plan that is actually rewarding you for wanting to use supplements and oils that are going to keep you healthier. They're rewarding you for staying healthy and doing the preventative things like functional primary visits. You're going to get 5 of those with an MD, a DO, a naturopath, a PA, or nurse practitioner. You're going to get 25 chiropractic or acupuncture or those combined per year, per calendar year, per person. And you can get 1 IV drip per month, and you can get a thermography once a year or a mammogram if you choose. So here's more details about the reimbursement rates of what you're going to get. So with the primary care visit, you get 5 preventative primary care visits. You will pay your provider upfront, cash pay, whatever that price. You're going to take your receipt, whether it's a super bill or an itemized bill for chiro or acupuncture. You're going to take your bill and then upload it to the app or the website in the holistic need request form. And then within 30 days, you're going to get, for a primary care visit, you're going to get up to $150 reimbursed. For chiropractic or acupuncture benefits, you're going to get up to $175 per visit reimbursed. And then you're going to get, for breast imaging, you're going to pay the first $150, and then the rest will be something that will be covered. I think I just said chiropractic and acupuncture 25, it's 24 visits, sorry, 2 per month. With IV drips, you're going to get 1 IV drip per month, and so you will end up prepaying upfront, submitting your receipt through the holistic need reimbursement form. You're going to end up paying $25 and get up to $100 per month reimbursed. And then $0 generics, and then preferred brand, you will have these limitations. 500 per year if you are on the holistic plan, 500 per month if you are on the ClearShare or ClearShare and holistic plan. So one thing I want to mention with chiropractic and acupuncture, especially with chiropractic, once you're an established chiropractic patient, you're going to go for your adjustments. Those usually are not going to be $175, right? So here's a little pro tip. If your chiropractor has a massage therapist or a raindrop technique therapist or does NAET, laser, has any kind of additional service, add those on for the same visit. As long as it's on the same itemized bill, on the same date that you go get a chiropractic visit adjustment, you will get up to $175 reimbursed 24 times a year. So again, this holistic plan really wants to reward you for staying healthy. They're willing to give us money and reimburse us for all of these things because they know that if they help support us with doing all of these holistic minded services, that we're going to stay healthier, which is going to keep us from getting a chronic illness, going into the hospital, and having more expensive care later. We all know in Young Living that by using our products, we're investing in our our health and our wealth, right? Our wellness and our health together. So by investing in our health with our products, but also chiropractic, acupuncture, IVs, going and seeing your naturopath, now we get to get reimbursed for these things instead of paying out of pocket, which can cost quite a lot of money. So these plans, ClearShare is going to reimburse us so much money. We are on the family plan, which is for 4 people. We're 54 years old, so we're the highest tier of cost, and we have the highest annual max of $5,000. So our monthly bill is about 900 something dollars. We're getting $575 back. We've got our $75 back for our oils and supplements. We went and saw our osteopath who does osteopathic manipulation. So we got $150 twice back for that. We do an IV drip once a month and we got $100 back from that. And so now we're going to go and find a chiropractor that has a massage therapist in their office and an acupuncturist now that we have these benefits and I don't have to pay an arm and a leg for out-of-pocket costs. So the amazing thing is $50 to $75 of Young Living essential oils or supplements are going to get reimbursed. All you're going to need to do is order through your own Young Living account. You're going to download your invoice. And then you're going to upload it, fill out the holistic need request form, and you're going to upload your Young Living invoice to that website or the app. And then within 30 days, you're going to get $50 to $75 cash reimbursed to your bank account. All of the money that you're getting reimbursed is going straight into your bank account. So the Young Living invoice needs to be submitted within 30 days of purchase. And if you end up having a whole family on this plan, any of those family members can add up to that $75. If you're not ordering $75 worth of oils or supplements on one person's, then you'll just submit all of the invoices from everyone in the family to ensure that you're getting the maximum $75 for couples or families. The other thing to know is you're going to want to put your order on loyalty rewards, right? So loyalty rewards, if you're not familiar with that, is our best rewards program out there. It's the best one for any kind of program. You're going to start getting 10% back for the first 3 months of the PV, the point value of your products. And month 2, you're going to earn a free Desert Mist diffuser. And then once you hit month 4, you're going to start earning 20% back of the PV every single month. And once you've been on the loyalty rewards program for 25 months, you're going to get 25% back of the PV. So if you're going to get $50 to $75 back from ordering 50 to 75 PV of product every month, you might as well put it on loyalty rewards. So you're not only getting that money, that cash back into your bank account, but you're earning those loyalty reward points and the freebies that come along with it. So here's a breakdown of the pricing. Okay, here's the holistic plus ClearShare. It's based on your age, and then it's based on the annual max. Now let's talk about the annual max. So there's $1,000, a $2,500, and a $5,000 annual max. We're choosing to do the $5,000 annual max. We're here, family of 4, 5,000. We're paying $940 a month. We're choosing to do $5,000 with the annual max because we get $0 telemedicine. We get $0 generic prescriptions. So the likelihood that we're going to have to actually pay the annual max is only if there's a catastrophic or emergency situation, which is rare. So we're willing to pay more if there's an emergency situation so that we can pay less every month. So that's something that you want to think about. So this is the best plan that's out there. It combines the holistic services and reimbursements with the ClearShare. So it will give you coverage for accidents, emergencies, and or major illnesses. This does not have a limit on how many children you have. So there are some health shares and insurances out there that have a cap on how many children. And if you have more children than that capped number, then you have to pay more. You can have as many children as you want to have with this plan. And it also covers unmarried children up to 26 years old. And they don't even have to be living in your home. So the ClearShare, the holistic plan, sorry, this is for anyone who wants to supplement their existing health insurance. So if you already have health insurance that you like, you're getting it through your work, you aren't paying that much for it, or you're on Medicare, then you can add on this holistic plan. So it's $233, $430 for married or cohabitating adults or single with kids, $517 for a family with kids. Now, know that with the holistic plan, there is no annual max with this plan, and there are no pre-existing condition exclusions with the holistic plan. So this would be an excellent plan if you do have some kind of medical condition that is pre-existing, but you like to go to holistic practitioners. Add on this plan. Remember, you're going to also deduct $50 for that single person, or $75 for the married, cohabitating, or family with kids each month for your Young Living product reimbursement, the oils and the supplements. And then you're going to get those reimbursements for all those services, those holistic services that we've already mentioned, right? So right off the bat, this price might look high, but think about how much you're going to save over the long term in terms of all of your out-of-pocket costs that you normally would pay to go see all of those holistic practitioners and do IVs and those kinds of things. This is the ClearShare only plan. So again, this one's for anyone who wants coverage for accidents, emergencies, major illnesses. This is a good plan for just people who don't care about the holistic services. Maybe you're on government assisted insurance. This would be an excellent option for you to do because you're going to get way better services. You're going to get that $0 telemedicine. You're going to get all of those services for a little bit more than free, right? But you're going to get way better costs and services. So this is a good plan for people who just want the coverage for accidents, emergencies, major illnesses. So who's eligible for these plans? Any Young Living brand partner or customer. So if you know people who aren't Young Living members, you're going to want them to become Young Living members first. Anyone who's over the age of 65 is eligible for the holistic plan only, and all unmarried children up to 26 years old are included in their family's plan. These plans are also available to anyone with the ITIN number. So that's a legal immigrant who is here. Apparently that's very hard to get health insurance if you're from another country but living here legally. So anyone with an ITIN. The great thing about this is there's year-round monthly open enrollment. So there's not just a time frame where there's only 3 months that you can join this. It's a year-round monthly enrollment. So what's going to happen is you will sign up this month, but you won't have services this month. You also won't pay for anything this month. You'll have services starting the 1st of next month, and you'll get billed around the 6th to the 10th of next month. But you'll have services starting the 1st of the month. Pro tip again, if you have a spouse account or a partner account, you can enroll them on your desired health plan, and then you will earn commission off of that. If you saw the 3 slides that had the different prices, there is PV involved with every single plan, and that PV is going to show up every single month. So here's a little example of just how easy it is to build a business, a sustainable recurring income using the Young Living health plans. So let's take an example of someone that's 40 to 49 years old in that tier. They're signing up for the Holistic Plus ClearShare plan. That gives you 101 point value per month just for the Holistic Plus ClearShare plan. But remember, with that holistic plan, they're going to get $75 worth of free product, supplements and oils, right? So you're going to encourage them to add $75 point value per month of products, ideally encouraging them to put it on loyalty rewards. And then every single month, you're going to have 176 point value per month showing up in your downline from that one person. So it's going to show up the month after they sign up, because the first month they're not paying for anything. And then that product, when they order their $75 or $50 if they're an individual, when they order their products, that PV is going to show up right away. The point value from the health plan will show up around the 25th of the month. So if you look at this chart, you really only need 57 people of this generic little overview. 40 to 49 years old, signed up for the Holistic Plus ClearShare plan, to have a silver OGV, to have silver OGV every month showing up on the 25th of the month is pretty phenomenal, right? So this is how you're going to help your business be less of a burnout. This is how you're going to build your business with more sustainability and recurring income, because not many people are changing their health plans month to month, right? And if they're getting $75 worth of product for free every month, why would they not purchase that? So it's a no-brainer that that point value that you're going to earn from the health share and their product purchase, if they're on the holistic plan, that's going to show up every month. So if you and your downline sign up 57 people to this health plan, your downline will have silver OGV. And that's, not too shabby in terms of the average annual income. So that is one thing that you really want to start thinking about. In terms of sharing with practitioners, This is a great way to help your friends who are practitioners that are chiropractors, acupuncturists, naturopaths, by helping them get educated about this plan and helping them share with their patients are going to save money. So there's no other health plan that has this many holistic services available. So it's a health plan with a majorly holistic aligned belief system that matches chiropractors, acupuncturists, naturopaths. And so those practitioners can share it with their patients. The practitioner would ideally become a brand partner. Now it's free to become a brand partner, right? They would share the plans with their patients. There's no money out of their pocket. They're not losing any money by having their patients sign up for this plan. They are still going to receive their money up front. They're going to give their patient an itemized bill, and then it's up to the patient to submit their bill every month or every service to get reimbursed. The patient will then get and recoup some of that money, which will hopefully go towards more services with that practitioner. It's also going to encourage that patient to add on more services at the chiropractor or the acupuncturist so that they can really take advantage of that $175 per visit reimbursement. So it can add another recurring income stream for practitioners. And like I said, the practitioner is still getting paid up front. There's no risk to the practitioner. And then for the practitioner, after they get through the fast start 3 months and if they want to continue receiving their commissions, all they have to do is order 100 PV per month, right? And hopefully they're going to be on this plan, at least the holistic plan. And so they're going to get up to $50 to $75 worth of Young Living supplements and oils reimbursed. So that 100 that they're required to purchase for earning full commissions will actually really only be 50 to maybe even $25 because they're going to get their oils and supplements reimbursed. So the patients will save more money and see the practitioners more often. So if you would like to see a pre-recorded webinar that goes more deeply into all the things that are included in each of the plans, you can go and scan this QR code, or if you would prefer to set up a one-on-one consultation with someone that works at Clearwater that is familiar with these plans, if you have extenuating circumstances or lots of questions, you can go and set up a one-on-one 30-minute free consultation. You can set up as many of those consultations as you want, and you will meet with a live person to talk through your own specific circumstances. Then when you're ready to sign up for your plan, you're going to log into your Young Living account. If you don't have one, you're going to create a Young Living account through whoever sent you to this presentation. You're going to write down your Young Living member number because you're going to need that. And then when you go to the main Young Living Health Plan website here at yl.clearwaterhealth.com, you're going to sign up for the plans that you want. There are additional add-on plans like a vision and a dental plan. Those we don't earn PV on those, but they are available. They have no network. They're really great. And you just want to make sure that you want to enroll the month before you actually want your services to start, okay? Because anytime this month, up until the last day of this month, up until midnight Central Time, you can sign up, and then you will start having access to services starting the 1st of the month, and then you'll be billed around the 6th to the 10th of the month. This is a whole slideshow that is created for you to share. So we have a Facebook group called the Young Living Health Plans Facebook group. It's a Team YL group. It's led by several different Crossline leaders. But this presentation that I just shared with you is available in that Facebook group for you to customize if you have Canva Pro. There's trifolds that are available, there's flyers that are available, there's lots of tips on how to enroll people. But basically, The main thing you want to know is that these plans are saving people hundreds of dollars. We were paying we would have been paying $2,800 a month for PPO through Blue Shield for a family of four with a $7,000 deductible per person. And we thought we were doing the right thing. We thought we were paying for the money that we would need if we had an emergency situation. But then our daughter got strep throat. We tried all the natural things. And when I went and called the pediatrician's office to get covered to go in to get an antibiotic, they wouldn't see her because she hadn't been in there for 3 years. And they said, nope, can't even see a nurse practitioner, can't even see a physician's assistant. And so that was absurd to me that we were paying at that time $2,300 a month and I couldn't get into the pediatrician's office. So with this plan, we're saving over $20,000 a year just with the monthly premiums. And then we're getting all those things back, all the reimbursements back. So I don't know why that just went to page 29, but let's go back to where we were. So there's lots of testimonials of the people who are benefiting from the health share plans. This person got a bee sting between her cheek and jaw. She did all the Young Living things. She was in a rural area and was not going to be able to go get into a doctor's office. And so she was able to use that telemedicine and get the prescriptions and get everything taken care of right from her phone. Here's my sister who was paying $800 a month for a health plan that she rarely used with a $10,000 deductible, and she's saving a ton of money by being on the Holistic Plus ClearShare plan. Here's some testimonials of people saving money just with the plans, and then some more. So we get $100 back on IV drips and belong to a place called Restore Wellness that has a bunch of different therapies, but one IV drip is included. But our monthly fee for this membership is $149 a month. So we're getting $100 back a month for that monthly IV, which means we're really only paying $49 a month for our membership to get cryotherapy, red light, sauna, lymph drainage. So it's really amazing. Kelly submitted a $195 claim for x-rays and a chiropractic visit. She got a direct deposit reimbursement of $160 within 72 hours. And the reimbursement rate right now is pretty short, but it can be up to 30 days. So it's really, really phenomenal. People are saving money left and right. And even if you're not saving a significant amount of money, you're going to get more services. You're going to get more freedom because, again, remember, there's no network. So you can choose anybody you want. And you have the care coordination service team available if you have planned medical needs, and you have $0 telemedicine. So there's another example of someone having some really positive results from being able to have this health plan available. And there you go. So start talking to your friends, your family about these health share plans. Start talking to your practitioner friends. Start contacting just wellness centers around you that have acupuncture, chiropractic, massage, all those kinds of services under one roof, and let them know they could be saving their patients money and they could be getting more money, earning more money from their patients by adding on those services. You could also start cold calling small businesses. Any small business under 49 employees is eligible to sign up for these plans. So the business owner would sign up as the brand partner for $0. They would offer the plans for They would offer the plans for their employees. And again, they would not be paying anything out of pocket to pay for their employees. The employees would be purchasing the health plan for themselves. And then the owner would be getting commission from the employees that are on the health plan. And then the owner can decide what they want to do with that commission. They can give reimbursements to their employees. They could offer employee retention benefits. If someone's staying working at the same place for over a year, maybe they're reimbursing that employee 10% of their health plan, 2 years, 20%, and just goes up each year. And if you saw the prices of these health plans, it's very affordable. So 10%, 20%, even 50% of the health plan is probably significantly less than what they would be paying to hire a new employee, to go through all the training and all of the money and time invested in trying to find new employees. So keeping employees happy by offering them these plans, the employee would again pay for it themselves, but the employer could offer some kind of reimbursement. So there's lots of ways to earn and get this consistent recurring PV to show up in your downline. So I really, really encourage you to join our Young Living Health Plans Facebook group to learn more about it. There's tons of information and shareable content already made for you for free in the photo albums, in the files, and you can learn a whole lot in that group. So come join us over in that group. I hope you found this workshop helpful, and I look forward to seeing you at convention.